Welcome back. Let's discuss black cumin, a quite interesting compound, antioxidant, antimicrobial, anti-inflammatory, immunomodulatory, anti-cancer. And the real hero of this medicinal spice is this compound called thymoquinone. Let me lead with a quote. Health benefits of black cumin and its bioactive thymoquinone cover almost every physiological system. Let's outline the systems that black cumin can benefit, juxtapose that with, do we have clinical trial evidence really substantiating this is something worth you considering supplementing with as it pertains to the following: infection, bacteria, viruses, fungus, parasites, thyroid health, joint pain, allergies and asthma. This is actually an antihistamine, sleep, and this pesky molecule called orexin that can interfere with sleep, but black cumin helps to modulate. Benefits for cognition, hormones, acne, cholesterol, and blood sugar. And we'll make sure to hit on safety, side effects, and then give you a protocol for use. And if it sounds like a list that's too good to be true, I kind of get that. I was impressed, I have to say, with the breadth of research on this medicinal spice. Now, as some background, it may not be a surprise given all of the benefit that we're seeing through contemporary research, that there's a fairly ancient use of this spice medicinally going back 3,000 plus years. You see at least discussions of its use going back to ancient Greece, ancient Egypt, and even in areas of Islam. So there's a long history of use. Doesn't mean that it's beneficial, and this is why we'll, of course, look through a modern lens of scientific scrutiny. But black cumin is derived from Nigella sativa plant with over 100 bioactive compounds that promote health. But again, it might be the thymoquinone that is the most beneficial. Starting our discussion, understanding that many of you are educated on and care about some sort of either infection or overgrowth, let me lead with a quote. Black cumin seed oil exhibits notable anti-inflammatory, antibacterial, and antifungal effects, and even goes so far as viruses. So we'll kick off our scientific discussion with how black cumin can fight viruses. Specifically, what black cumin does to strengthen your immune system is increase these cells known as CD4 cells. They're a type of T cell. You can think of T cells as a really important orchestrator of the immune response, specifically the adaptive immunity. Humoral immunity is your mucous membranes, and then adaptive immunity are the antibody responses. Now, the antibodies are B cells, but the B cells, the antibodies, they need to have a tagging. In fact, if you've ever watched a military movie where the army has to paint with a laser the target so that bombs can be dropped and hit that target, this is kind of what the T cells do for the B cells. The T cells tag whatever the immune system should be attacking so that the B cell antibodies can successfully fight that pathogen. And so because of this, it's not surprising to see a 2024 meta-analysis of 3 clinical trials in over 1,000 COVID patients in this case, who were given black cumin seed oil, realized some pretty remarkable improvements. Now, the oil was given in conjunction to standard care, so it wasn't a standalone therapy, but nevertheless, they found a 78% relative risk reduction in mortality or death. Quoting, "Our findings indicate that administration of oral N-sativa in patients with COVID-19 in conjunction with standard care could significantly reduce their risk of mortality during hospitalization." So pretty interesting. And by the way, if this is helpful, please comment, like, and subscribe. This really does help us reach and help more people. Moving on to fungus, because we said antiviral, fungal, bacterial, and parasitic. The black cumin actually binds to and damages the fungal membrane, leading to cell death. Now, we don't have interventional data here. All we have is in vitro. So some cautions are merited, But at least in vitro, sort of in cell line studies and culture studies, black cumin has been demonstrated to have activity against Candida, Aspergillus, and Penicillium. So perhaps it could be a antifungal, or at least used as part of a broader, more comprehensive antifungal approach. Parasites. This is something that we've been discussing on the podcast of late, and I wanted to make sure to flag this for you. Black cumin actually has antiparasitic action by increasing oxidative or a sort of inflammatory stress within the parasites, damaging their DNA, thus inhibiting successful protein replication, therefore cell function, therefore cell death. Now, again, here we only have either animal or in vitro data, but it's interesting nonetheless. Thymoquinone from the black cumin seed has been shown to be fairly potent antibacterial. We've discussed babesia on the podcast in the past. One large survey of donor blood from a blood bank found 20% of people had detectable babesia in their blood. Now, it doesn't mean that the babesia is causing problems in all those people, but for people whom have been under significant stress or consuming too much alcohol, plus not sleeping enough, and their immune system becomes weakened, this is when something like babesia, a parasite, might be causing symptoms. And there was another 2024, again, animal study that found black cumin seems to have a similar mechanism to some of the commonly used anti-malarial antiparasitics. But again, what we don't know is how these mechanistic findings will map on in human use. So what I would say is if you suspect you have a parasite, babesia, or something else, I would not look at black cumin as a standalone therapeutic, but perhaps could be used as part of a larger therapeutic approach. There's a similar mechanism for bacteria wherein black cumin disrupts the bacterial cell membrane and can specifically inhibit biofilms. Now, the context regarding biofilms is if you've used some sort of antimicrobial or antibiotic, seen improvements, and then regressed, what may have happened was you eradicated the planktonic or free-living bacteria, but the other bacteria that are sort of sequestered and protected in a biofilm were not eradicated. So weeks or months after you stop the antimicrobial therapy, your symptoms return. This is what might be novel about black cumin. And we do have some interesting interventional data here. 2016, open label trial in about 20 people with Helicobacter pylori. This is a bacteria that typically resides in the stomach or the first section of the small intestine, can cause things like ulcers and dyspepsia, indigestion. These individuals were given black cumin with no other treatment, and they experienced a 57% eradication rate in only 2 weeks. And they had improvements of dyspepsia or indigestion, heartburn, discomfort. In addition to that, we discussed before considering black cumin as part of a more comprehensive treatment plan. And this is where 2 randomized control trials look at conventional H. pylori care, antibiotics, antacids, combined with black cumin, and have found anywhere between a 74 and 88% eradication rate. In fact, when using more therapies, you see a jump from that 74% eradication rate up to that 88% eradication rate. So this would be black cumin plus either one antibiotic or multiple antibiotics, essentially. And the concept here I wanted to tie in was the rationale for multiple therapies here is the same as it is for our triple therapy probiotic, meaning it's a fairly uniform observation that a monotherapeutic approach is not as effective as using multiple therapies at once. And that's exactly the concept that we've applied to triple therapy probiotic, which is essentially combining 3 different probiotic formulas together to hit at least a theoretical higher level of efficacy. And here is a protocol that you can use for H. pylori. 1 teaspoon of black cumin seed oil, or 2 grams per day of a soft gel or capsule, plus 1 tablespoon of honey, which was used in some of the research here. And I would leverage this with the triple therapy probiotic. And that's a great starting point. Give this 4 to 8 weeks and then reevaluate. And if you're still experiencing symptoms, this is when reaching out to a healthcare provider who can guide you further would probably make sense. But just wanted to, again, give you this protocol so you have some direction. Now, there's also at least a loose connection between H. pylori and thyroid function. So it's not surprising to see a 2016 randomized control trial in 40 Hashimoto's or thyroid autoimmunity patients demonstrate benefit when using black cumin. They were given either placebo or black cumin, and after 2 months, there was a reduction of TSH, an improvement or an increase of T3 levels, a 147-point reduction in TPO, and a slight decrease in weight. I would just flag for you that other therapeutics seem to have a slightly better impact on specifically TPO antibodies, namely vitamin D, selenium, myo-inositol, and red light therapy applied to the throat thyroid gland area. So again, I see black cumin as not this super powerful magic bullet, if you will, but one compound that can be added to more of a comprehensive treatment plan. So as we've been discussing the ability of black cumin to fight infection and therefore lower inflammation, it shouldn't be surprising also to see improvements in joint pain, which comes from a few different mechanisms. Lowering inflammation, and part of that lowering of inflammation may come from revisiting this concept of the T cells tagging appropriately for the B cell antibodies. Aberrancies or malfunction in T cells can lead to incorrect tagging of food particles, environmental allergens, and there then lead to inappropriate antibody responses and the resultant inflammation. So it's probably not surprising to see that we can reduce levels of inflammation with black cumin. We also see, sort of as a parallel mechanism, inhibition of the COX enzyme, which is the same inflammatory enzyme that NSAIDs like Advil will block. But as I always say, show me the data, show me sort of the interventional data if we have it. And there is a 2022 randomized control trial in just over 100 patients with knee osteoarthritis, placebo versus black seed oil. And after 1 month, there was a 34% reduction in knee pain and a 28% increase in physical function. And maybe most importantly, there was a reduction in painkiller use, which is going to have a benefit not only on reduced medication, but these NSAIDs do have a deleterious impact on the gut. So really, I think a pretty interesting finding. Now, building upon this sort of inflammatory immune T cell, B cell mechanism, we come to reductions in allergy and asthma. Beyond what we've already discussed, interestingly, black cumin is also an antihistamine and a mast cell stabilizer. So it sort of calms down this overzealous immune system response that's kind of hallmark of many atopic, allergic, and asthmatic conditions. So I would expect to see, and we do have clinical trial data supporting the efficacy here. 2024 randomized control trial, 65 patients with seasonal allergy were given placebo or black cumin oil, and they found decreased serum IgE antibodies and eosinophils, a reduction of nasal and eye symptoms, and severe symptoms were reported in 66% of those on the placebo, but only in 3% of those taking the black cumin. Again, this is probably because if the T cells are tagging molecules appropriately, you will not have seasonal allergens tagged for attacking by the B cell antibodies. Really interesting to see this sort of immunomodulatory effect culminating in outcome data vis-a-vis a clinical trial. And additionally, there's a 2020 meta-analysis looking at asthma, also showing favorability. Again, this is why when I said earlier, does the list seem almost too good to be true? It kind of does until we start looking at the evidentiary body supporting its use. And, again, I would also say may not be a standalone therapeutic, but something I think to definitely consider as part of a larger therapeutic approach. And no discussion would be complete without touching on sleep. And we covered earlier this molecule, orexin A. Orexin A is a molecule that helps with wakefulness and attention. But if orexin A is too high at night, then you'll have what so many have reported, myself at some points in time included, you're laying in bed and your mind is just racing. Part of this can be orexin A induced. It can also be cortisol induced. And this is interesting in that black cumin modulates favorably both cortisol and orexin A. Again, show me the data, 2024 randomized controlled trial, 70 adults with non-restorative sleep were given either placebo or black cumin, and they found a 75% increase in sleep quality, a 19% increase in total sleep time, and a 35% improvement in time to fall asleep. Now, there is one caveat here, which is this study was funded by the company that made the supplement. However, when we reviewed the methods, it did seem like they followed all of the due precautions and they weren't sort of trying to cook the numbers in such a way that misrepresents their findings. So even though this was industry funded, I had no indications of foul play, if you will. And then if we look at this juxtaposed with a larger body of evidence, there's a pretty good case with other mechanisms or outcomes that black cumin does seem to be efficacious. Now, through modulation of that orexin A and cortisol, if you have appropriate daytime levels, you should have healthy cognition. And if you don't, you'll have impaired cognition. And it's actually not uncommon to see this sort of skewing where during the day, you don't have enough cortisol or enough orexin A. And then at nighttime, paradoxically, you have too much. And so you can't sleep. So when you need to be on, you're tired. And when you need to sleep, you feel like you're sped up or you're stimulated. This is where, again, we see this modulatory impact that leads to improvements in cognition. And there's another mechanism we can add here, or two mechanisms, which is black cumin reduces neuroinflammation. So we're thinking here things like astrocytes and microglial cells, which regulate inflammation in the brain. But then also there is a inhibition through black cumin of this enzyme known as acetylcholinesterase. And acetylcholine is what acetylcholinesterase metabolizes. And you want to have robust levels of acetylcholine because this is a really important and sort of primary neurotransmitter for learning, memory, and even for gastrointestinal motility. By inhibiting the enzyme that breaks down acetylcholine, you have more of a buildup of acetylcholine and therefore better executive function. This is a similar mechanism as leveraged by many Alzheimer's drugs, and even huperzine A, a natural moss derivative that we've discussed on the podcast in the past. Even thiamine, vitamin B1, has an impact on assisting with synthesis of acetylcholine, which is part of the reason why when people are thiamine deficient, they can have sort of pseudo beriberi, which is Swahili for I can't, because they're tired and they can't think, in part because they don't have enough vitamin B1 or thiamine to make acetylcholine. So there's multiple ways we can get to healthy cognition, one of which is having enough vitamin B1 thiamine to synthesize acetylcholine, but another is using natural medicinals like black cumin to slow down the metabolism of acetylcholine so you have a good amount of this in your system so that you can neurotransmit and then therefore think and have enough mental energy. And this is where it's reassuring to see a clinical trial of 40, in this case, elderly adults who were given either placebo or black cumin, and they found improvements in cognitive testing as it pertains to memory, attention, processing speed, and cognitive flexibility. Coming now to hormones. One of the additional interesting things about black cumin is it has phytoestrogen properties, meaning that it modulates estrogen levels, specifically the estrogen receptor. Another way of thinking about this is it's adaptogenic. If levels of estrogen are high or low, black cumin can bring it back to center. And in my training, the way this was taught to me was phytoestrogens, so in this case, black cumin, but there are others, they bind to and stimulate the estrogen receptor. And they do so somewhat weakly, meaning not in a very strong sense. Now, if you are a woman with a pre-existing low level of estrogen, then the situation you're in is you do not have all of your estrogen receptors binded to and stimulated by your endogenous estrogen. So you have these empty, non-docked estrogen receptors. That's when a phytoestrogen like black cumin can bind to and bring you from a low sort of cellular stimulation level of your estrogen receptors up to a normal level. So hence, low levels of estrogen are brought up. Conversely, if you have high levels of estrogen, the phytoestrogens compete for those receptors with your endogenous estrogen. And since they have a somewhat weak stimulation effect on the receptor, they actually bring the estrogen stimulus down. And especially if a woman has excess, let's say estrone, which is much more powerful in its stimulation effect than estradiol or estriol, then this is where the phytoestrogens can really start bringing down the symptoms of estrogen excess. And one of the questions that we'll get in the clinic is, well, should we be testing my hormone levels? And I think there's a time and a place for that, especially if you're going to be using HRT. So estrogen, progesterone cream, pills, injections, pellets, whatever, mainly so you can prevent an overdose. But with these plant compounds, again, because they're adaptogenic, there's not really a necessity to test, which is nice because it takes one barrier to entry off the table for use. But again, show me the data. And there's actually a number of them here. 2023 randomized control trial found improved urinary incontinence in menopausal women. Now, what's probably happening here, this is more prevalent in older women, and this is because the tissues of the urinary tract and the pelvic floor have less of a youthful action. And much of this comes down to estrogen stimulation, which is stimulatory to tissue, again, and we want the appropriate amount. Too little or too much is a problem. The Goldilocks amount is really what we're after as a recurring theme in physiology. As women age, tissues age, and they are less functional, and this can occur in multiple tissues: breast tissue, hair tissue, skin tissue, and urinary tract and pelvic floor tissue. So this is where the phytoestrogenic effect of the black cumin has merit. In this study, the seed oil was given as 2 to 3 drops applied below the navel 2 times a day. I'm not sold that you have to use it in this topical application because a oral administration will also have systemic, including pelvic floor and urinary tract, impact on estrogen receptors. But nevertheless, there are a few considerations regarding black cumin, its anti-aging, if you will, phytoestrogen effects, and how this can impact urinary incontinence, but also other female hormone-related symptoms. Separate to that, 2019 clinical trial found improvements in hot flashing in postmenopausal women. And also that's probably due to the modulation of estrogen, obviously. And then a 2024 clinical trial in women with PCOS. And again, black cumin improved a number of hormone-related symptoms, including irregular menstruation. It also decreased testosterone levels and decreased facial hair growth. For or from the hormonal modulation impacts of black cumin, we should probably see improvements in acne. And also when we add to that the antibacterial effect, this can also have a beneficial effect on acne. So unsurprisingly, a 2020 clinical trial found improvements when compared to placebo in acne vulgaris, and also found a reduction in acne lesions, severity, and acne-associated reductions in quality of life were all improved from the black cumin oil. And regarding acne, the study that found benefit in acne from black cumin seed oil actually used this, again, as a topical application, as a gel. And there are some creams available on the market as you see depicted here. I'm unclear on how potent and efficacious these are going to be for acne because the research here is still preliminary. And there's not a huge selection, but it's a starting point for people who may want to experiment. And certainly for the cost, I think it's pretty reasonable. And remember that the mechanism here is probably twofold. One, the antibacterial nature of black cumin, antimicrobial. And secondly, the estrogen modulating phytoestrogen effect. And the final point here, it's a long list. There are 2 separate meta-analyses of clinical trials finding that black cumin can lower total cholesterol, LDL, improve HDL, lower triglycerides, lead to a 10-point reduction in fasting glucose, and a 0.6% improvement in hemoglobin A1C. So again, pretty impressive. I would just echo one more time that this may not be a totally effective standalone therapy for all of these conditions, but I think could be considered as part of a more comprehensive plan for any of these. Regarding safety and side effects, pretty strong safety profile based on all the above data. There was really a very minimal or no signal of any sort of contraindication or significant negative side effects, other than in some people having some nausea and bloating, some skin irritation when applied topically, and some dizziness and headache, which I do wonder, given the antibacterial, antifungal nature, if some of this is just a byproduct of sort of a die-off reaction, if you will, of the antimicrobial action. And there are no really good long-term studies on black cumin seed oil. So this is why in the protocol that we'll come to here in a second, we're recommending a truncated use of roughly 3 months. And so let's close out our discussion with the protocol. So this is looking across this myriad of clinical trials. What are the dose ranges and forms used? You can use as a pill, as either a soft gel or a capsule, as an oral oil, but it does have a bitter taste, or topically. Now, if you're using it as a pill or a capsule, 500 milligrams up through 2,000 milligrams per day for 2 to 3 months. And the oral oil is 1 to 2 teaspoons per day for 2 to 3 months. And the topical cream, as directed, I would start with a small amount, make sure it's tolerated, and then you can sort of increase the area that you're applying it to, again, for 2 to 3 months. And then a few things to look for regarding manufacturing. You want to look for a high thymoquinone content. That's sort of, again, like the hero of this story. Cold pressed or C2 extracted usually leads to higher thymoquinone content. Organic, so that it has minimal fillers or additives, a dark color or a non-see-through bottle to protect from oxidative and sort of light stress, if you will, and then third-party testing for purity and for screening of contaminants. So in recap, I hope you now see where my interest in this compound comes from. It's a antimicrobial helping to fight bacteria, viruses, fungus, and parasites, can improve thyroid function, assist with joint pain, help with allergy and asthma through being antihistamine, mast cell stabilizing, and T cell regulatory, can improve sleep through modulation of cortisol and orexin A, can improve cognition, can help balance hormones, namely estrogen, improve acne, lower cholesterol and blood sugar. Seems to be fairly safe and effective, obviously, due to the clinical trials that we've examined. And again, we outlined a protocol for use. I'll leave you with this quote: "A healthy person has 1,000 wishes, a sick person just one." I hope this helps you on your road to improving your health. This is Dr. Ruscio. Talk to you next time.